But what are 3 practical tips that you could share with our audience to help them advocate? How can they talk to their primary care provider, or if they're in a specialty cardiologist or an oncologist? What are 3 practical tips that you can help them communicate their need and advocate for themselves to get access to germline genetic testing?
And what I tell patients and, again, members of my family to advocate for is to remember the higher goal. I need to make sure I'm getting the appropriate cancer screenings. And the only way that I can do that is if I know my risks. So I first ask people to advocate, understand their risks. I think my second point is that really age doesn't matter anymore. We are looking at so many patients who are being diagnosed at early and earlier ages and later stages. And the only way to overcome that phenomenon is if we try and train our physicians and train the people who are caring for us to think about true risk. It kind of forces them to think further. And then number 3 is to share your story. If you have any family members, if you have any friends who have been through this experience where they really were impacted by an unnecessary cancer that could have been caught earlier, that could have been intervened upon earlier because of a genetic risk factor or a familial risk factor. Doctors are human, and the more that you tell these stories, the more they can understand that you know it's really, really important, and you need them to feel it's important too. So those would be my 3 tips.